Today on Investigate TV, newborn screening failures, deadly disorders tested for in some states, but not in others. Experts call it death by zip code.
And I don't want another child to suffer the way he suffered.
If our daughter had been born just 3 hours north, we would be living a totally different story.
Plus, insurance controversy. Doctors warn a recent change could mean fewer options and longer wait times for cancer patients.
It's my body. I should be able to make the decision of how I want to feel comfortable for the rest of my life.
Investigate TV starts right now. Hello and welcome to Investigate TV. I'm Lee Zurich. Every year, millions of babies are born in the U.S., and nearly all of them are tested for disorders. Early detection and intervention are key to saving lives and beginning treatments early. But where you live determines which diseases a newborn is screened for. Joce Sterman dug through federal data and found those disparities could mean the difference between life and death.
It starts with a pinprick on the heel of a tiny baby just hours old. Then a few cries and a few drops of blood imprinted in 5 circles on a basic paper card. It all looks so simple, but what's collected on these samples from babies just beginning their lives could tell a complex story that changes them forever.
It's great because that one tiny little blood spot, we can get so many answers.
Answers that come from newborn screening done on every baby born in the U.S. before they leave the hospital. The tests look for certain conditions that might not be obvious at birth. A few you likely know, including cystic fibrosis or sickle cell anemia. But many are so rare they impact just a handful or maybe only a few hundred children nationwide, but may have devastating or deadly consequences.
How critical are these screenings when it comes to babies and their health?
It's absolutely critical that every baby is screened. So most of these conditions are incredibly rare. Generally, there's not a family history. Family may have never even heard of this. A doctor may have never heard of it.
Susan Tanksley has. She oversees the Texas State Lab responsible for running tests on hundreds of thousands of newborn screening cards.
This represents 88 different babies.
Babies whose cards are punched and run through what feels like an assembly line of old and new school testing techniques and equipment. And it happens in labs just like this all over the country.
So with this instrument, we're able to screen for 44 different disorders, and that's core conditions and secondary conditions on the Recommended Uniform Screening Panel.
The Recommended Uniform Screening Panel, or RUSP, is an ever-expanding list of conditions created by a federal committee. Since 2002, that committee has been reviewing evidence, listening to testimony from experts and advocates, and then recommending tests they think states should perform on newborns. Right now, the RUSP is limited to just 37 conditions and diseases, but there's nothing uniform about its implementation or newborn testing in general nationwide as states make their own mandates. Our national investigative team discovered the things your baby is screened for depend on where you live, with each state deciding for itself which screening it can carry out, while facing challenges with funding, equipment, and qualified staff.
I can tell you that any newborn screening program is doing the absolute best that they can with the resources that they have and under the constraints that they have.
Those constraints create disparities, and from state to state, they could mean the difference between life and death.
Your life shouldn't be dictated by the zip code you live in.
In many places, it is. And the loss of Elisa Seeger's son set her on a mission to change that.
I don't want another mother to be me, and I don't want another child to suffer the way he suffered, because I can't really explain how bad that suffering was.
Aiden Seeger seemed like a happy, healthy 6-year-old. It was problems with his vision that led to a diagnosis of adrenoleukodystrophy, or ALD. The disease, which impacts the brain and nervous system, first took Aiden's sight, then his ability to function, and eventually his life just a year later.
And I said, why are we not testing for this condition? Because if we would have known at birth, he could have been monitored and treated before it was too late for him.
ALD testing eventually came first in New York, where the Seegers live, after Elisa lobbied at the state level to have the condition added to their screening panel in 2013. Then in 2016, she successfully helped make the case to get ALD on the RUSP. But more than 7 years later, only 35 states and D.C. include it in their newborn screening, even though it can be fatal, as it was with Aiden.
They're already taking those blood spots from the baby's heel. So this is something additional at the lab level. And it's just mind-boggling to me why this is such a difficult battle.
It's a war to save children that's being fought state by state, with borders often creating a dividing line that can be deadly. Our national investigative team spent months comparing data from the U.S. Health Resources and Services Administration, or HRSA, which tracks screening. Our team found there isn't a single state in the U.S. testing for all 37 conditions on the RUSP, although Illinois and Missouri come close, with 36 conditions on their screening panels. Hawaii tests for the fewest number of RUSP disorders, only 29.
The things that are on the list now, I cannot come up with a health-based reason for them not to be uniformly screened in all 50 states and however many territories.
It's a failure to not have them screened.
It's another failure of our healthcare non-system.
Strong words from Dr. Ned Kalanch, the man leading the committee that approves recommendations to the RUSP before they're given final approval by the health secretary. He says his highest priority after becoming chair last year was to try and get every state to implement testing for conditions already on the RUSP. Kalanch's committee can recommend all they want. When it comes to actually carrying out the testing, that's out of their control.
I would say it's discouraging and dismaying to have a condition that we've recommended that we feel meets that bar and that those conditions aren't being tested for. You can have two states that are just, one line apart on the map and have very different screening lists.
And it doesn't stop with the conditions listed on the RUSP. Many states require tests that are not on that federal list. Those differences create even more disparities. We found as many as 88 different newborn screenings being performed around the country. We found 16 states and D.C. test for a condition known as 2,4-dianoyl-CoA reductase deficiency, but there are only 2 known cases of the disorder. On the flip side, about 20,000 babies are born each year with a potentially fatal cytomegalovirus, or CMV, but only 1 state tests every baby for it.
They're taking the choice away from us when they don't screen.
There she goes.
Sarah and Keith Strevel wish they could have had more moments like this with their daughter Bella. Activating her tiny hearing aids on her first birthday gave them a precious gift. Bella's infectious laugh and smile captured on video. CMV cost Bella her hearing, caused seizures and other medical problems. The disease wasn't part of the newborn screening panel where they live in Kentucky, and was only caught later when she went to the NICU for tests that would reveal the difficult road ahead.
So she was completely non-mobile. She was nonverbal, so everything had to be done for her.
You just got to take it one day at a time and keep moving forward.
In the days and months that followed, Bella was their superhero. Her battle eased by the sound of wind chimes, the feel of her giant stuffed giraffe, and the purple wheelchair that still sits waiting for her in the family's living room. After her death at just 3 years old, the Strebels' fight continued. They successfully lobbied for a state law named in Bella's honor. It requires targeted CMV screening for newborns who are symptomatic, something her parents want expanded to universal testing, not just where they live, but across the country, with the condition hopefully one day added to the federal list.
How difficult is it to keep up the fight to get it on the RUSP? Do you lose motivation?
We kind of feel like that RUSP is out there and it's kind of the magical ending, but we don't have a clue when that's going to happen, and we can't wait.
A wait for testing that could turn little lives that are just beginning on their heel, all because of where they were born.
Check out our website, InvestigateTV.com, to learn what your state is screening for and to see more stories from the families impacted by newborn screening failures. Coming up, a tragic loss, a disorder that could have been recognized earlier, one parent's fight for change after the break.
I knew that for me, advocacy is how I continue to be her mom.
Welcome back to Investigate TV. Newborn screenings catch rare conditions in more than 12,000 babies a year. But despite the critical need, the programs that make it happen aren't getting the funding they need. And Joce Sterman discovered some states are worried they can't keep up.
You can really see a difference.
For Lisa Brackbill, the day her life changed forever can be traced back to this one photo, a picture showing her wide-eyed baby girl Tori smiling for the last time.
It was truly like a switch had flipped.
It was January 2015 when their happy, seemingly healthy 5-month-old stopped progressing, seemed to be in constant pain, clenching her little fists and crying. 6 weeks after that final smile, a diagnosis, something called Krabbe disease, a rare disorder that would take Tori within a year.
We loved her even more in a different way, a more fierce way, after we found out that we weren't going to have her for very long.
As the Brackbills began a baby bucket list, they discovered the disease that ended Tori's life could have been caught in newborn screening. That's the heel prick testing done on babies across the U.S. When Tori was born, Krabbe wasn't on Pennsylvania's screening panel where the Brackbills live, but it was being tested for just over the border in New York.
And if our daughter had been born just 3 hours north, we would be living a totally different story.
The kind of story our national investigative team found families nationwide are living. We discovered disparities in newborn screening from state to state, creating a tragic phenomenon known as death by zip code, with where you live dictating what babies are tested for at birth. Krabbe, we found, is now included in screenings done in at least 10 states, but it's not yet on a recommended list of tests the federal government wants to be uniform nationwide, something Lisa has vowed to change in her daughter's honor.
I knew that for me, advocacy is how I continue to be her mom.
It's advocacy for newborn screening that experts say is critical to finding rare conditions early and saving babies' lives.
Generally, you don't catch anything, but when you do, you've just made such a difference.
Right now, 37 core conditions are recommended by the federal government, but we found not a single state in the U.S. tests for all of them. That's something pediatrician and Congresswoman Kim Schreier and other lawmakers want to change by 2025. To make that happen, they called on congressional leaders in this recent letter to prioritize funding and appropriations for newborn screening.
You know, whether you get these newborn screens shouldn't depend on what state you happen to live in.
States decide for themselves which testing they'll carry out. They also foot the cost of the work, with some help from the federal government. There's a bill in Congress, the Newborn Screening Saves Lives Reauthorization Act, which should funnel millions to state screening. But it's repeatedly been held up in recent years because of debate about research using the baby blood samples.
It's incredibly frustrating to the advocacy community because so much is tied to that funding.
The federal funding helps fill the gaps in state budgets and inside state labs that we've learned are already stretched thin, with screening programs filling the pinch as more and more conditions are added, either because of federal recommendations or through individual state mandates. Our national investigative team spent months contacting every state health department across the nation, asking their biggest challenges when it comes to keeping up with those new additions. 43 states and D.C. responded. Almost half told us funding and staff shortages are their greatest hurdles. Difficulties finding equipment, lack of lab space, and quality control for testing were also major concerns. Among the most striking responses, Illinois, where the health department told us if they keep adding new conditions without more funding, it would compromise their ability to run the screening program. Michigan, which said state programs struggle to effectively recruit, train, and maintain lab staff. And Hawaii, which told us some states don't have the specialists they need to test for newer conditions, and that quality assurance is hard to do when they have to chase to add new disorders.
It's very challenging.
Especially for people like Susan Tanksley, who runs the Texas State Lab that handles their newborn screening and knows the difficulties faced by screening programs across the nation.
Failing is not an option because the babies we're serving, the families we're serving are incredibly important. So we have to succeed.
Is that an airplane?
Success for moms like Lisa Brackbill, who's watched newborn screening grow and change like her own family, means getting programs the money they need to one day eliminate disparities altogether, closing yet another health divide that impacts our most vulnerable.
Want to hear more stories like this? Check out the Investigate TV YouTube page for our latest content and partnerships. Up next, a warning. We look at an insurance recoding that could limit breast cancer patients' medical options.
You will probably see less opportunity to get the more complex procedures performed.
That story after the break. Welcome back to Investigate TV. Last year, the American Cancer Society counted more than 18 million Americans with a history of cancer. It says about 1 in 8 women will develop invasive breast cancer during their lifetime. Now more and more people survive, but advocates warn a health insurance change could negatively impact recovery. Holly Thompson has more from Nashville.
Smiling through the tough moments.
Once you hear the words that you have cancer, your life is forever changed.
Kimberly Pointer believes having a double mastectomy after her 2020 breast cancer diagnosis was the right decision for her.
Just kind of wiping out the fear of the cancer returning as much as possible.
Then came the question of reconstruction.
I just wanted to feel as normal as possible.
There are 2 popular options: implants or a procedure called deep flap, where a patient's own tissue is used. But soon, doctors and advocates say the choice may become more complicated. It all has to do with insurance billing codes.
Should breast cancer survivors be concerned?
The bottom line is absolutely yes. You will probably see less opportunity to get the more complex procedures performed.
Starting in 2025, Medicare will only have 1 billing code for all flap procedures. Advocates say the coding change means doctors will be paid less for the newer, more complex deep flap procedure, possibly leaving patients with bigger bills or fewer doctors performing the procedure, meaning longer wait times. Those outcomes don't sit well with doctors.
If there was one group of patients that deserve to be cared for, it's this group.
While Pointer selected the option for implants, she says all patients should get the opportunity to do the research like she did to make the best choice for themselves.
It's my body. I should be able to make the decision of how I want to feel comfortable for the rest of my life.
The American Society of Plastic Surgeons met with CMS June 1st in hopes that they'll re-examine the change. It's also lobbying Congress and state legislatures to enact better post-mastectomy coverage requirements. Without insurance, a deep flap procedure could cost tens of thousands of dollars per breast.
While we're on the subject of pricey medical procedures, let's take a look at medical debt. Our Carice Jackman spoke with a researcher about how these costly healthcare financing options are impacting patients.
Healthcare providers in recent years broadened the scope of medical credit cards and loans to help patients alleviate medical costs for basic treatments and emergency health care. But according to a new report by the Consumer Financial Protection Bureau, these loans and credit cards are typically more expensive for patients than conventional credit cards and have interest rates often reaching above 25%. It's why it's important patients know what they're signing up for before leaving the doctor's office. According to the CFPB's report, people paid $1 billion in deferred interest payments for these healthcare charges between 2018 and 2020. And most of the people with the highest interest rates tend to be patients already struggling with low credit scores. So what should you do? Find out the interest rate for the medical credit card or loan before you visit the doctor. If the card or loan has a high interest rate, consider using one of your existing credit cards with a lower rate, and ask the provider about their financial assistance policies. With this watching your wallet, I'm Carice Jackman.
Thanks, Carice. To keep up with our latest investigations, follow us on social media. We're at Investigate TV on Facebook, Instagram, and Twitter. Coming up, a unique prescription, a medication alternative for kids with ADHD that may surprise you. Welcome back to Investigate TV. Attention deficit hyperactivity disorder. Millions of Americans have it, but many are struggling to fill their prescriptions to treat it. A labor shortage at the largest manufacturer of Adderall impacted supply. Manufacturing issues at the maker of Vyvanse also affected inventory. But Susan Campbell shows us another treatment alternative.
Some providers are writing prescriptions for kids to play a video game. It's not just any game. It's specifically designed to work part of the brain that helps with attention.
Go ahead and play.
Maddie's on a mission, racing through an icy river and collecting rewards along the way. This may look like any old video game, but it's actually a game only available by prescription. It's called EndeavorRx, and it's approved by the FDA.
It seems to be helping quite a bit for her.
Rebecca Pro is Maddie's mom. She says Maddie was diagnosed with ADHD when she was 7 years old.
After seeing the scans of her brain, we started doing stimulants right away. It took a while to actually find one that worked really, really well for her, but she still needed a little bit of extra focus support, especially midday, and I didn't want to put her on another stimulant.
That's when the conversation about this video game started. Rebecca was skeptical. A prescription for screen time?
Everything that we're taught for anyone with ADHD, you would think that it would totally be counterintuitive, but I mean, it works.
The game is approved for kids 8 to 12 years old.
It is a therapy. It is an intervention.
Nicole Zuka is a physician assistant at the ADHD Clinic of Arizona.
There's so many parents that feel stuck, that feel like medication's the only option.
She says that's not necessarily the case. She says the video game could help develop parts of the brain that may be underdeveloped.
By stimulating those areas, it's almost like building a muscle. The more you use it, the stronger it gets, right? So you're using that neuroplasticity to kind of develop strength in those muscles.
It's prescribed for 25 minutes a day, 5 days a week.
And the people who are consistent with the therapies, after the first month, I would say about 50% notice improvement in their attention span and their ability to sit at the table and do their homework a little bit. The longer they play, the more you see the compounded benefits.
Maddie typically plays this game right after school, and her mom says it is making a difference.
Just kind of gives her a little bit of push and extra focus for the rest of that day.
EndeavorRx is not covered by a lot of insurance companies. It costs $99 per month. The company has a financial assistance program. If you're looking for more investigative reporting on demand, download our streaming apps on Roku, Apple TV, and Amazon Fire TV. And that's it for us. Thanks for joining us here on Investigate TV. We hope to see you next week.